GlasSpan offers a simplified method of periodontal splinting for periodontists and restorative dentists who need to stabilize mobile teeth such as these. Create a channel wide enough for the GlasSpan rope and restorative resin, mesiodistally along the occlusal surfaces of the teeth to be splinted. The depth and width of the channel should create a cross-sectional surface area approximately 4 times that of the piece of GlasSpan rope selected. This assures adequate room for the hybrid composite resin, which, together with the GlasSpan, provides a fracture-resistant splint. For this periodontal splint, you'll need a small or medium GlasSpan rope. Before chemical preparation of the tooth surfaces or placement of resin into the channel, measure the length of GlasSpan required for the splint. The procedure for cutting GlasSpan rope is the same as for cutting GlasSpan tape material. First, place a small amount of clear bonding resin on the GlasSpan. Cure it with the polymerization light. Cut through the bead of cured resin with any pair of sharp scissors. This leaves a clean, unfrayed working end. Confirm that the length of GlasSpan cut properly fits into the channel. The GlasSpan rope may be coated with a clear bonding resin followed by a porcelain veneer luting cement or flowable hybrid composite resin as previously described. As an alternative, the flowable hybrid composite resin may be injected into the GlasSpan rope for extra strength using a needle tip syringe. Regardless of the method you choose, you must always coat the external surface of the GlasSpan rope. The internal surfaces of the channel are etched for 15 to 20 seconds with phosphoric acid and thoroughly flushed with water. After placement of a universal dental adhesive, the internal surfaces of the channel are coated with a thin layer of clear, unfilled resin and polymerized with a curing light. Place a thin layer of posterior hybrid composite onto the floor of the channel. Seat the GlasSpan rope into the soft bed of hybrid composite, positioning it far enough into the channel so that it clears the occlusal surfaces of the teeth being splinted. Polymerize with a curing light. Additional layers of the posterior composite resin are incrementally placed and cured until the channel is slightly overfilled. Using fluted carbides, the splint is contoured and the occlusion is adjusted. Finishing and polishing is now completed. Check the margins to make sure that they are smooth. Confirm that the embrasure spaces are open so that the splint will be easy for the patient to clean. The GlasSpan splint, fabricated more simply and quickly than metal-supported alternatives, is predictably strong and highly aesthetic.